Hey, it's Kieran Miller from Injury Free Fitness, and today we are talking about ice packs. So cryotherapy is another way of saying cold therapy, so cold treatment. Like when you watch footballers and they use the magic sponge, they run on the pitch and put ice spray, cold spray, or icy sponge, or you might see like a football player, for example, getting injured, coming off, let's say for example it's knee pain, he'll then have a bag of ice strapped to his knee while he's on the bench waiting for the game to finish. So why do they do this? Well, in my experience, both me becoming injured from playing football myself, like sprained ankles, different bits and pieces, and also me applying it when I used to do touchline first aid and recommending it to clients. Now I do private stuff. It helps to do a couple of things. First of all, it decreases pain. So of course, with the inflammation, you're going to get heat, swelling, redness, soreness, and the ice is basically going to help to decrease most of those symptoms you get with inflammation. But the main one in the short term, I guess, is pain. But more than that, really, what we're looking at is speeding up recovery. So making your injury recover faster, or getting you back to being able to do what you were doing before faster than previously was able, if you would just kind of let inflammation run its course and succumb to all the things that has. Now, a lot of people will say that, why would you want to stop or prevent the body's natural healing process? And the reason why is really chemically. When you become injured, the damaged tissue is going to release certain chemicals, and those chemicals are going to bring more chemicals to help clear the damaged cells and also protect the area. And that's where you see extra fluid come into the area, and that acts as, I guess, like a kind of cushioning to restrict movement and stop you from further injuring that area. So that's one example. Now, the problem with too much swelling or too much of these chemicals, for example, I'm thinking particularly macrophages, what they do is they come and they absorb injured cells or dead cells, but those macrophages also can affect healthy tissue as well. So what you don't want to see is that chemical process kind of upsetting or harming too much of the healthy tissue as well as the tissue that needs to be gotten rid of. So it's kind of like, an analogy would be like if you were going to start some work on a house and you were going to get some laborers in to kind of gut the place and rip bits out, is if they started to rip out too much stuff and they started to take out some of the foundational bits or maybe bits you wanted left in there on the building work, and now you're going to have to replace that as well as doing the bit that they should have done in the first place. So that's kind of a little analogy of how the chemical process of macrophages sometimes can be a hindrance more than a help. Also with swelling as well. So I mentioned that already, that you're going to get this swelling come into the area, and the ice is going to help to constrict the blood vessels, make them tight, stop too much edema and swelling going into the area. And again, that's beneficial because although you do want to limit movement, we're smart enough to know that when we're injured, we're going to have some period of restriction or rest. So what we don't want to do is have the swelling do that job and have too much swelling, and then now, after the effects of the injury, now we have to work harder to get back our full range of movement because there's too much swelling. By putting the ice on, it's going to constrict that, limit the amount of swelling you get, and then means that you can quicker rehab that area and get back to kind of playing sport or whatever else you wanted to do. So ice is definitely a help. I'll give you an example. I think if, for example, you sprain your ankle and it would take you 3 weeks to recover after the initial onset, to then, let's say you don't do any intervention, no ice, no elevation, nothing, you just get injured, stop playing, and then you don't do anything for a couple of days. I think if you don't have early ice in those early stages, especially the first kind of 3 days, then you'll find that it will really slow down your recovery. So that might take 3 weeks for like a grade 2-ish sprain before you're back to sport. But I honestly believe even if you have a grade 2 sprain, so like a pretty bad sprain, then you could go back to sport even as soon as 1 week if you put ice in the mix as soon as possible, or within the first, say, hour of you actually doing that, for the reasons I gave before. So definitely, I think it can benefit you. Now, in terms of how you should apply the ice, you need to be careful because you can get an ice burn. So, for example, if you have an ice and you put it in a plastic bag and you apply it direct to the skin, then you find that it's going to be too cold and you can actually damage the skin and cause an ice burn, which obviously you don't want to do. It's going to be too cold as well. So what we tend to go for in sporting arenas, you'll see like crushed ice in a plastic bag. That's fine because it'll melt quicker, and you won't find that you get the ice burn with that so much. Now, if you're not in the sporting arena, you're not professional, then I would definitely recommend more of like a gel pack or ice pack that you store in the freezer. I'll put a link in the description to ones I would recommend and have a look at those. The ones I would recommend, they come with a compression sleeve as well. So you put the ice pack in the freezer, it gets hard, and then I would recommend as well having two, so that way you could always bring them in a rotation. So say for example you play squash and you get you injure your knee, for example, you go home, take the ice pack out, you put it in the compression sleeve, you put it on your knee, and then after about maybe 30 minutes, your knee is obviously going to warm up the ice pack, it's going to melt, get soft, and then it's not cold enough anymore. And then at that point, if you wanted to, you could then maybe leave it off for 5-10 minutes, go down, put the used ice pack back in the freezer, take out the unfrozen one, reapply that and put it back on. And then this way you can have a nice rotation going between the two ice packs, so you can keep the knee on ice, as it were, for a long period of time. In terms of like how long you want to use it for, let me just say, so going back to the compression sleeve, the compression again is going to give you the added benefit, well, two reasons. One, you're going to help to limit the swelling and the effects of what we spoke about earlier in terms of having that compression as well as the ice is like a double whammy. So to help speed up the recovery. And then the other thing is, if you want to move around still but have the ice attached to you, the compression just is a nice way to keep the ice pack in place but allow you to still walk around and do things, whether you're in the office or at home or whatever you want to do. The compression sleeve just helps to hold it in place. So in terms of timings, what you want to do is, I would recommend, if it's a gel pack, then you can leave it on until it gets warm. So that might take, like I said already, half an hour, 40 minutes. Once it's warm, you can go straight in again and reapply another one. Because they're not so cold, you're not going to get the effects of an ice burn, so you can have them quite on long enough. I would recommend having some time. If it's like a really cold pack, then I would recommend like a limit of maybe like 10 minutes, and then have 10 to 20 minutes rest after to allow the tissues to warm up again. And later on, after I would say probably the first 24 hours, you might want to use that like a hot and cold treatment. So you're going to put the ice pack on for like 10-15 minutes, then rest for 10-15 minutes. I wouldn't necessarily advocate putting heat on there, depends on the severity, but just enough would be ice pack, no ice pack, ice pack, no ice pack. And then you can rotate this as much as you feel comfortable to, but once or twice is more than enough. And then also, like, common sense will tell you, like, okay, I've settled things down, it's not hurting anymore, I can leave it for a period and then come back. So you kind of do have to use your own judgment. There's no kind of really rule to say like the maximum benefit. In terms of studies and stuff, where they see the most benefit is definitely within the first 72, 74 first 3 days. You need to get the ice on there as early as possible after the injury. So pretty much as soon as you can, really, once you become injured, specifically acute injuries, bang it on there. And then that's it really. That's all you need to know. So apply the ice as soon after an injury as possible. Rotate the ice for as long as you can. So if it's a gel pack, keep it on there. If it's crushed ice, probably again you want to leave it on there once. And then if you're going to do the same crushed ice again, then you probably wouldn't want to put it on for at least another hour. So give it an hour rest, and then mix it up. And yeah, that's it. Definitely, if you play any sports or you ever find yourself in a situation where you become injured all of a sudden, ice will definitely help to get you back quicker. If you like the video, like, comment, subscribe. If you have any questions, comment, and yeah, check out the link below. Thanks.